Hi y'all, how y'all doing today? I'm Dr. Alancia Wynn and welcome to Health Chat. So today we're going to be talking about headaches. Now in my practice, headaches is one of the most common reasons that people come in to see me. Now they can be caused from everything from concussion to a bleeding in your brain to high blood pressure that's not controlled to a brain tumor to anything and everything in between. And it can be from something super minor to something that's potentially life-threatening. So we're not going to have time to talk about all the causes of headaches today. So today we're going to focus on 4 of the most common causes. And then at the end, I'll talk to you a little bit about kind of the things that make headaches potentially more serious, the things that you don't want to wait. You want to go see your doctor right away if you have that happen when you're having a headache. So the first thing we're going to talk about is eye strain. And that's just what it sounds like. If you are using your eyes too much and they're getting strained and that's causing headaches. And that usually happens only after prolonged reading or computer or smartphone use or prolonged TV watching. It also may be associated with a decrease in your vision, which means you've had your glasses for 5 years, you can tell you're not seeing as clearly as you did before, but now you're starting to get these headaches more often. And usually, if you come in, you're having a headache, and you have some of those same symptoms, usually you get your vision checked, or your doctor will either check it there or suggest you go see your eye doctor. And if the vision is not corrected appropriately, then you'll get new contacts or glasses, and usually that takes care of the problem if that's what was causing the problem. Usually a pretty easy thing to fix, just getting your vision corrected, and that usually takes care of the problem. If your vision gets corrected and you're still having the headaches, then it was not caused only just from the eyes. It may have been part of the problem, but it wasn't the complete problem. If it was the complete problem, it would have gone away. So the next thing we're going to talk about is what I've called a cluster headache. Now, what a cluster headache is, it's a severe headache that typically causes pain just on one side of the head. It can be either side, or it can be behind the head or just around one eye. It's never on both sides. It's always just one side, and when it occurs, it's always on the same side. And it tends to happen over and over again at the same time every day for several days or several weeks in a row. And then you go several weeks or months without having any episodes, and then it comes back. Hence why it's called a cluster headache, because the headaches tend to happen in clusters of days or weeks. This tends to affect adults over the age of 30, and for some reason that we don't really understand, it affects men more than it affects women. So what are the symptoms of a cluster headache? What makes you think you might be having a cluster headache as opposed to one of the other types of headaches? Usually it's a sudden onset. So you're sitting there, you're fine, all of a sudden, boom, you have a headache, and it's severe. And sometimes they can even happen at night when you're asleep. You don't have a headache when you go to bed, and then you wake up in the middle of the night and you have this horrible headache on one side of your head or around your eye. And the pain gradually gets worse and worse, and then it usually peaks within anywhere from 15 minutes or so, and it typically lasts about 2 to 3 hours, and then it goes away. And that's if you don't take any medicine or do anything. It just goes away on its own, usually within that 2 to 3 hours. As I said, it can have pain around one eye. Patients usually describe this as a severe piercing or boring pain. It's like someone's kind of taking an ice pick and jabbing it into your head or jabbing it into your eye. Sometimes it can be so painful that you tear up from the pain. Sometimes people can get a swollen or droopy eyelid on the side that is affected, usually not on the other side, but just on the side that you're having the pain. You can sometimes get a stuffy or a runny nose associated with it, so sometimes people think this is a sinus headache. It can also be associated with a slow heart rate, again, for reasons we don't really understand. And we don't know if the headache causes the slow heart rate or if the slow heart rate causes the headache. It can also be associated with nausea, usually not vomiting, just nausea, and people can break out in a sweat because of the severity of the pain. What causes cluster headaches? Well, we don't really know. But as I said, the risk for these headaches does increase if you are a male, if you are a person over age 30, male or female, but the risk is higher in males. If you are a current smoker, you have a high risk for developing these. If you have had a previous head injury, whether it's a concussion or something more severe, even if it was years before, that can sometimes cause these cluster headaches. People who have sleep apnea, which is where you stop breathing for short periods in the middle of the night, those people tend to have a high risk for developing cluster headaches as well. And people who are under high levels of stress are high risk for developing cluster headaches. So how do we treat this? Again, we don't really understand a whole lot about it, so there's nothing that we can give to treat you based on getting rid of the cause, since we don't know what the cause is. So the treatment is directed at treating the pain. So we give you pain medicine as needed. We teach you how to kind of know what your triggers might be, because certain people have triggers that can cause one of these to come on. Stress can do it, as I mentioned, anger or bright light, if you drink a lot, or even if you get excited, even if it's something good, if it's a good excitement, that can trigger a headache. So you want to figure out what those triggers are and then try to avoid those triggers if at all possible. And sometimes people have more than one trigger, so it's not easy as just, oh, if I just don't do this, then I won't have them. Sometimes you have to figure out maybe 3 or 4 different things. So every time you have a headache, you have to say, okay, what's been going on in the couple of days or so before this happened? That might be a trigger. If you notice a pattern that every time I get one of these headaches, it's because I was at a party the night before and I drank too much, or I had a fight with my spouse, or something like that. Those are the kind of things you need to kind of be a little bit of a detective to kind of figure that out. And you also want to try to limit the amount of stress just generally in your life, especially if you've realized that stress is one of your triggers. Even if you're not sure if stress is one of your particular triggers, just decreasing stress in and of itself sometimes decreases the frequency and the severity of these cluster headaches. And for some reason, some people, if they start exercising vigorously right when they're starting to get a headache, it tends to make the headache shorter. Again, we don't really understand. Sometimes people can have these headaches triggered by certain foods that contain nitrites. Nitrites are usually in things like smoked or processed meats. If you find that every time you eat something like that, you're having a headache, and you recognize that as a trigger, just avoiding those foods, and that typically will decrease the frequency and the severity of the headaches. So the next headache we're going to talk about are migraines. So migraines, everybody has heard the term before. A lot of people know someone, either a friend or family member or someone in their circle that has had migraines or thinks they have had migraines. Sometimes people will call something a migraine just because it's a severe headache. And so there's a lot of times there's some confusion between, is it a cluster headache, is it a migraine? But most lay people tend to think every severe headache is a migraine. Every severe headache is not a migraine. So we're going to talk about what an actual migraine is. So a migraine is a severe headache that is associated with warning signs. You have an aura, which we'll talk about what that is in a minute, at the onset of the headache, and then you get tired, you have some tiredness after the resolution of the headache. So what we call the prodrome, which is kind of the warning signs before the headache, they can occur hours or even days before the pain starts. So how do you know what these things might be? Typical things that happen before a headache include changes in mood. People can get kind of irritable or sad or depressed or withdrawn. Typically, they can have changes in behavior associated with that change in mood. They may not want to do things. They may want to sleep more. They may want to not interact with other people. They have a decrease in energy. Sometimes they have a change in appetite. Sometimes the appetite can go down, but sometimes the appetite can go up. And a lot of times it's hard to realize that those changes in mood are due to a headache. Again, because they happen so far ahead of the headache, you may not associate those changes with the headache itself. And also they're pretty subtle changes. You know, any of that could be, oh, well, she's really tired, or he had a bad day at work, and so that's what's causing those. It's hard to pin that down to a headache. If you start noticing a pattern over time, you may eventually start to recognize that, yeah, every time I get this headache, yeah, the day before I felt horrible. And then you can start to recognize, okay, if I feel horrible, that might mean that a migraine is going to start coming. It's important to recognize how migraines start, which we'll talk about in a minute when we get down to talking about treatment, because the faster you can start the treatment for a migraine, a lot of times you will decrease the severity or decrease the length of time you have the headache. So, and we'll kind of come back to this a little bit as we get down further talking about migraines. So I mentioned the word aura. So what an aura is a change that happens up to an hour before the start of a headache. It's usually no more than that. It can be a few minutes. It can be right before you can have the aura, and then boom, you have the headache. But typically it's a few minutes, 15, 30 minutes, somewhere in there. Like I said, it can be up to an hour. And it's usually affecting one of the senses. So it's not like the prodrome, when we talked about, where it's kind of these vague general symptoms. An aura is something that affects one of your senses. It's usually vision, smell, or hearing, or sometimes it's a combination thereof. The most common auras are visual, which means you see something that is not there. So sometimes people will have kind of bright spots that are flashing in their vision. Sometimes people will see like a zigzag pattern in their vision. Sometimes people will have an area of their vision that is just not clear. It's almost like if you're looking through a window and you have this thumbprint or a dull spot or a dirty spot or a water spot or something in the middle of this window. You can see through it, but it's just not quite as clear. And that's true for anything, any of the visual auras. You can see through it. And that's important because there are some times if you have a headache and you see a black spot that you cannot see through, that's not an aura that's associated with a migraine. That's a completely different issue. And so that's more, that's something we'll talk about later when we talk about the more severe headaches. But like I said, so the visual aura is something that you can see through, and it can last several hours usually. And once the headache starts, the aura typically goes away. So just to review, you have the prodrome, you kind of feel a little off, then you get the aura, and then you get the headache. So then once the headache starts, this is a dull pain, and it can involve the entire side of the head. So if you remember when I was talking about the cluster headaches, it also involves just one side of the head, but that's more of a severe pain. It's like somebody hit you in the head with a brick kind of thing, of the cluster. A migraine is a dull pain. It can be severe, but it's not that sharp feeling like somebody hit you in the head or stabbing you with an ice pick. It's more of a dull pain. And that pain, once it starts, it can last anywhere from 4 hours up to 72 hours if you don't treat it. Everybody's a little bit different, but everybody typically has their pattern. So if people who have short migraines typically always have short migraines. People who have long migraines typically always have long migraines. It's rare for someone to have, normally they have these 4 or 5 hour migraines and all of a sudden they have a 72-hour migraine. It certainly is possible, and we'll talk about that when we talk about the risks and things in a few minutes. But typically, once your pattern is set, that's kind of your pattern for your migraines. So if you have a prodrome before the headaches, then you can have a postdrome. Postdrome just means after. So that means what happens after the headache. So the headache lasted 4 to 72 hours, however long it lasts. The headache is gone. You are no longer having any pain, and then you're having the postdrome. And those symptoms can last anywhere from several hours up to several days. And it does not matter how long the headache is. So you can have a short headache and a long postdrome, or you can have a long headache and a short postdrome, or you can have short and short or long and long. But again, just like the headache pattern, typically the postdrome pattern is the same for each person. So what are the symptoms for the postdrome? Typically you just feel exhausted. You feel weak. You feel tired. People describe themselves as just feeling all wrung out and just worn out. However, there are a few people who just get elated. They are just so happy. They're just off the charts happy. And some people think that that's just because they're happy that their headache is gone, but most people feel like that is just a different, more unusual form of a postdrome. And we don't really understand why some people get one symptom as opposed to another. But again, like I said, your patterns are typically the same for each individual person. So just like with the cluster headaches, we don't really know what causes migraines either. We do think that there is probably some type of genetic component to it because there does seem to be an increased risk if you have a family history of migraines. And the more people in your family that have had migraines, the higher your risk for developing migraines. So if your mother and your sister and your grandfather all had migraines, it's much more likely that you will develop migraines at some point in your life than someone who may have had just one cousin 3 generations ago that used to have migraines. They also are more common in females. Remember, cluster headaches were more common in males. Migraines are more common in females. And the thing about migraines is they tend to decrease in severity as the person ages. So if you start having them when you're in your 20s and 30s, by the time you're in your 50s and 60s, they tend to get less. They may not, and they may become less frequent as well. So just like with the cluster headaches, you can have things that can trigger migraines as well. Some of them are the same, some of them are a little bit different, but just like in the cluster headaches, it's important if you start developing migraines that you pay attention to what your triggers are. And you, just like with the cluster headaches, you may have more than one trigger. So the more triggers you can identify and can eliminate or avoid, the greater likelihood it is that you will have fewer migraines. You may still have them, but they may not happen as often. So just like with the cluster headaches, there are certain foods that can trigger a migraine. The processed meats, so those nitrates, again, can do it. Red wine is another one that is a common trigger for a lot of people. The aged cheeses are a trigger for some people. Certain drugs are also a trigger. And again, you just have to kind of figure out, okay, well, if I ate this and I got a headache, then, okay, well, maybe I should not eat that. Maybe that's going to be a trigger. Some people like to, well, that might be a trigger, let me try it again. And you can certainly do that. Just know that if you do that and it is a trigger, then you might trigger a headache. Another trigger for a lot of people are bright lights, bright sunlight, bright artificial light, especially lights that are kind of in their face. So if you're out in bright sunlight, you're not wearing sunglasses, and you're in the direct sun, that's going to be more likely to develop a migraine in you if bright lights are a trigger. Some people also get migraines with weather changes. So sometimes if you hear people talk about, oh, well, the storm must be coming because I'm getting a headache. They're not making that up, because some people are, changes in the barometric pressure can trigger a headache. And then also high altitude. So if you are living at sea level like we do here, and then you go up to Colorado, that may be enough to trigger a migraine, and that's due to the decrease in the oxygen, excuse me, in the air. Because the higher you go up in altitude, the lower percentage of oxygen is in the air, and if you have migraines, that can trigger a migraine in you, just that. Even if you don't notice in any other way, that can be enough to trigger a migraine. Also stress, just like with cluster headaches, stress can be a trigger for migraines. Physical stress or emotional or psychological stress, any of those kind of things can cause migraines or be a trigger for a migraine. So what are the treatments? Again, since we don't know the cause of the migraines, just like with the cluster headaches, the treatment is primarily just symptomatic. So number one is you want to try to figure out what your triggers are, knowing that you may have more than one. And then once you identify the trigger, try to avoid those triggers if at all possible. Obviously, you can't not ever go outside if it's a sunny day, or you can't always never be under stress, but you try to minimize the exposure to those triggers as much as you can. There are medications you can take for the attacks, and going back to what I said before, remember I talked about how it's important to try to recognize what that prodrome is or what your aura is. The reason you want to do that is because if you're taking a medicine just for the attack, the sooner you take it, the better it works. So if you wait and you've already been having the headache 2, 3, 4 hours, the medicine may take 2, 3, 4 hours to work, and so then now you're 8 hours into the headache. Where if you take it when you first start, oh, I think this might be a migraine, take it, it works better. So then by the time it kicks in 2 to 3 hours, then that will be a way to get rid of the headache faster. Some people, if they're having a lot of migraines, frequent, every week or every couple of weeks, to where it's really starting to impact their life, there are medicines that you can take on a daily basis to prevent the migraines, and then take the medicine for the attack when you have the attack. So the next type of headache we're going to talk about are tension headaches. Those are the most common cause of headaches. They may be chronic or they may be episodic. When episodic is typically what you think of as a headache. And that's you're fine, then you get a headache. You take some medicine, the headache goes away. What chronic headaches are people who have these headaches 15 days out of a month. It's a dull, steady pain on both sides of the head, or some people describe it a band, like if you're wearing a hat that's too small, that kind of thing. So that's how you can tell that it's a tension headache as opposed to a cluster or a migraine. Remember, both of those happen just on one side of the head, either side. Tension headaches, usually both sides, or the top, or a band around your head. Just like the other type of headaches we have talked about, we don't know what causes these either. We think they may be due to muscle tension of either your neck, your scalp, face, or your jaw. Because sometimes if you're sitting all clenched up, that can lead to a tension headache. So what are the triggers for tension headaches? Lack of sleep, abuse of either alcohol or other drugs, stress. The stress can cause a lot of these headaches. Poor posture, because again, that puts stress on those muscles of your shoulders and your neck and your scalp. Certain foods, same thing like the other ones. Caffeine withdrawal can actually cause these. If you're someone who drinks a cup of coffee or 2 cups of coffee or 4 cups of coffee a day, and then suddenly you just stop altogether, that caffeine withdrawal can cause a headache. Some people can get these headaches if they don't eat on time, if their blood sugar drops a little bit. That can cause that. Being fatigued, if you're doing some type of intense physical activity, especially if you are not used to this intense physical activity. Say you're moving and all of a sudden you're lifting all these heavy boxes, something like that. That can cause these tension headaches. Hormone changes in women. So a lot of times women can get these headaches either around their menstrual cycle or in the middle of their menstrual cycle when they're ovulating or something like that. Those are the most common triggers. So what's the treatment? Again, we don't know what causes it. So just like with the other ones, figure out what the triggers are, figure out what might be causing them, especially if you are someone who is having these episodic headaches. If you just get the occasional headache once every 6 months or once every 3 months, it's less important for you to try to figure out what the trigger was. You just want to make the pain go away. But if you are someone who has these episodic headaches where you're having them day after day, several times a month, half the month you're having a headache, that's when you want to try to figure out what those triggers are to minimize the frequency of those treatments. And the treatment is pain medicine. You can start off with the over-the-counter medicines, either acetaminophen, which is Tylenol, or you can use ibuprofen, which is Motrin or Advil, or you can use naproxen, which is Aleve. Any of those are good medicines for the pain. If you have tried the over-the-counter medicine and they don't work, that's when you want to see your doctor. They may want to do a prescription, which is a stronger version of those medicines, or another type of medicine, especially if you're having those episodic headaches where you're having several headaches in the week. So now that I've thoroughly confused you, well, hopefully I haven't thoroughly confused you, but hopefully I've kind of given you an idea of the different types of the common headaches. So I do want to just spend a couple of minutes talking about the less common headaches and the reasons that you would want to see a doctor about a headache, because most of these headaches, once you figure out what they are, if you're having migraines, you don't need to see your doctor every time you have a migraine unless something is changing, unless they're getting worse or the medicines aren't working anymore, or something's going on. But once you've seen the doctor to get the diagnosis, you don't need to see the doctor for every single migraine. Same thing with a tension headache. If you're having just the occasional tension headache, you take your acetaminophen, it goes away. You don't need to see the doctor for that. If you have anything out of the ordinary associated with it, then absolutely you should see your doctor. But if you think, oh, it's just a regular headache, I don't need to see the doctor for that. Some of the things you want to think about that are a potential emergency that you definitely should see a doctor, and you should see a doctor right away. Either if you can't get in to see your primary doctor, then go to an urgent care or an emergency room. If you have a sudden onset of a headache and you've never had a headache before. So it could be a cluster headache. It certainly could be the first cluster headache you've had, but we don't know it's a cluster headache because it's the first one you've had. So anybody who's having a brand new headache, same thing with a migraine. If you're having a brand new headache, you need to see your doctor so they can figure out if it's a cluster headache or a migraine or something else. If you have a headache that you describe as the worst headache in your life. The worst headache I've ever had, you need to see a doctor, because that potentially could be something going on. It could be bleeding in your brain, which could lead to a stroke, or so just having a really severe headache that you've never had before. Even if you've had migraines or cluster headaches, or you've had tension headaches, but this headache is different. This headache is so much worse than my usual headaches. You need to see a doctor. If you have any headaches that are associated with any type of paralysis or weakness on one side of your body, arm, leg, face, if you're having trouble speaking because you're having a headache, if you have any change in your vision, that's why I'm talking about those black spots. Remember, with the aura for the migraines, it's kind of a fuzziness or something you can see through. But if you're seeing black spots that you cannot see through, that's a sign that is potentially more than just a migraine, and more. So there's something else going on. So you definitely need to see your doctor for that, because you want to rule out the bad things that are potentially life or limb threatening before we just say, oh, well, it's just a migraine. Not to diminish migraines, but it's a migraine as opposed to an aneurysm in your brain that has burst and you have bleeding in your brain, or you're about to have a stroke, or your blood pressure is sky high, or any of the things that are potentially, like I said, life-threatening or limb-threatening. So if you ever have a question about a headache, then obviously go to see your family physician so they can do the exam they need to do, listen to your history, your symptoms, do the exam, see if anything is out of the ordinary, see if your blood pressure is normal, see if they see anything that's different. Because if there's ever a question, always you want to go see your doctor rather than trying to figure it out yourself at home. But if you have any of those, what I call red flag symptoms, sudden onset, severe headache you've never had before, vision changes, any paralysis or anything like that, get yourself to the emergency room, get checked out all as soon as possible. So that is all the time we have for today. I hope I have helped you figure out a little bit about what's going on with the different types of headaches there are, and let you know that the vast majority of them are nothing to be concerned about, nothing to be alarmed about, but you do have to keep an eye out for those things that are potentially worse than just your typical headache. And as always, I am Dr. Alancia Wynn. This has been Health Chat. It's been good chatting with you today, and I will see you all next time.